some other kids are just, you know, off the wall for other reasons, but yeah, we all know some of them, right? But so over time, you're able to learn about things in your environment through vision versus having to touch it. Smiles and views of favorite objects, and people enjoys watching moving wheels, egg beater, watching their own hands scribbling. So they're starting to be able to draw now. It's the color. So this is 3 to 4 years old. So they can they can draw and name a circle and cross on paper at this age, or they should be able to. It's copying some figures. They're starting to get ready for reading. Starting more drawing. They're starting to be able to cut and paste. Starting to use more communication to identify and locate things. So at that age, they're starting to recognize color. Well, they could recognize color before that, but they're starting to be able to put labels on them so they can identify which color is which. So these are your typical milestones that you guys probably all know. Eye-hand coordination, the pincer grasp of a raise and develops at 12 months. They can build a tower of 4 cubes at 20 months. So I always test kids on what they can draw, especially at that age, like 4, 5, and 6. And this is kind of what we'd expect from a child at that age. So any developmental delay could be a signal that there's a vision problem going on. So when I think of visual skills, we think of it as a pyramid with the foundation of the pyramid being healthy eyes and brain. So you have to have a functional brain and a functional pair of eyes and get a clear message to the brain to be able to develop further visual skill. Next, you have to be able to use the 2 eyes together. If one eye is straight ahead, one eye's elsewhere, then you might see double. So putting those, so you get double images, you can't really make sense of stuff. So putting those 2 images together is important. Visual perception and cognition, I kind of lump together there. But that's how you perceive and interpret and get meaning from what you're seeing.
Make that pyramid crooked to test our vision.
Sorry?
Make that pyramid slightly crooked to test our vision.
Was it crooked?
Yes. It could be the protection.
Oh, okay. Yeah, actually it is crooked. Right. Some specific visual functions. So sort of the major 3 is what I'm looking for like if a kid gets referred to me, is how well they focus from near to far, how well they scan from left to right, and then how well they coordinate their eyes together. So focusing is far to near focusing. They can do it accurately at 2 to 3 months, but it's not really refined at that age. It takes a lot of time to learn the skill of focusing the eyes correctly at each distance. So, you know, I get a lot of kids who look at textbooks or reading, and they have to focus their eyes at this distance. And when we test them, their eyes might be focused back here or here, and it'll create blurry vision and headaches and a lot of eye strain for them. So for people who, you guys will probably work with head injured cases and TBI, ABI. a lot of those patients will have these types of issues, so focusing problems, eye tracking issues, and so you get people with strokes or concussions or head injuries that they won't be able to read anymore, they won't be able to write, and a lot of times it's because of this too. 3 months usually develops tracking, the ability to track and follow slow-moving objects. By 4 months, they're able to follow objects and reach for things. Depth perception, again, it's not present right at birth. It's only until you're able to align the eyes up and get them together that you would be able to see 3D vision. So face recognition comes right away. By 2 to 3 months of age, they'll begin to notice facial features like the nose and the mouth. By 3 to 5 months, most babies can differentiate between mother's face and a stranger's face. So as physical therapists, you know, a couple questions might arise, like what you should be looking, as far as vision goes, what you might be looking for, what are some of the referral indicators, and what ages might you want to be looking for these types of things. So we've kind of been through those. Really, a lot of it comes from knowing what the milestones are and what age you'd expect what behavior at. So I'll give you some of these things. If you have kids symptomatic like this, with redness, crusting, discharge, styes, tearing, it might indicate infection. So those need to be sent out right away. It's like especially eye turns that are acute, not necessarily chronic, but just show up one day. That could be a sign of something serious. So those people would want to be referred like pretty much right away. Again, bright light. See a lot of kids like that, especially on the autism spectrum. A lot of those kids will be really sensitive to bright light. If you see kids that close one eye or cover one eye or they turn their head, a lot of times it'll mean that they favor looking through one eye versus looking through both eyes. So that's a tip-off that it could be some sort of like a binocular vision problem or eye coordination problem. There's some symptoms. Patty, I think you might have this checklist that if you want you can send around sometime.
Okay.
I don't have a copy of it with me, but so for vision therapy, if some of those visual functions are not developed at the way that we expect them to at a certain age, we would do vision therapy. And as you could tell, I mean, a lot of these visual functions really impact learning and schoolwork, reading, writing, that sort of thing. So we don't do vision therapy for too many people under about 4 or so, unless they have a turned eye. We're working on that. But the earliest we'll see somebody for an exam is about 6 months to a year. The next, if we're suspicious about something, we'll want to see them back in about age 3 and then 5, right before they start school. And so I'll go through some. So vision therapy, similar to physical therapy, is training the visual system. So they come into our office about once a week, and then we give them home activities to work on with a partner or their parents that they have to practice. So usually we'll be seeing kids or adults in therapy for probably 15 weeks to 30 weeks or so. That's kind of how long it takes. That's probably a lot longer than somebody would do physical therapy.
Yeah.
But they're only coming once a week, though?
Yeah, they're only coming once a week.
Usually PT, 2, 3. So.
Depends on the age, yeah. I see a lot of people with head injuries, and they'll have done PT for maybe like 2 to 3 sessions, and it's fine. But I don't know if that's normal.
Yeah.
6 to 8 weeks.
6 to 8 weeks, yeah, it's pretty short.
And they can, depends if it's an inpatient or an outpatient setting. can be longer, up to 3 months if it's
Outpatient.
inpatient, and then 6 to 8 weeks, and then a recertification.
Yeah.